Welcome back to MLT 240. In this mycology lecture, it's going to be broken up into three parts. We're going to be covering superficial, cutaneous, subcutaneous, and systemic fungi. But in this lecture, we're going to be covering only superficial fungi. General characteristics of our superficial fungi is they're usually non-invasive. It involves just the top keratin containing layers of the skin and hair. Infections are usually asymptomatic. The fungal agents do not activate the tissue response or inflammatory actions. Patients usually seek treatment because of cosmetic concerns related to the infection. You usually observe superficial infections more so in tropical climates, but they're occasionally seen in the U.S. For diagnosis, you use skin scrapings or plucked hair are usually the specimens of choice. Let's first discuss the superficial species of Malassezia furfura. It causes tinea vesicolor, which is patchy lesions of scaling or varying pigmentation, also thought to cause dandruff. It produces fawn-colored spots on patients with pale complexions or pale spots on patients with dark complexions. It involves the chest, the face, the trunk, and the abdomen. It has complex growth requirements. For identification, you can use a KOH prep. Under the scope, it's said to have a spaghetti and meatball appearance, and we'll see this in an image coming up. But this is caused by budding yeast with septate and sometimes branched hyphal elements. Here is the patchy skin of a patient that has Malassezia furfura on the skin. This is the vesicolor patches. You can see the light colored or the foam colored patches on the skin. Here is the spaghetti and meatball appearance of Malassezia furfura under the scope. The next species up is Pedra horte or Pedra horte. This species causes black pedra, which is an infection of the hairs of the scalp. It produces a hard, dark brown to black gritty nodules that are firm and attached to the hair shaft. Nodules consist of asca, which are sac-like structures that contain 8 ascospores. Treatment is cutting or shaving all the hairs in the affected area. Diagnosis can be using KOH or 10 to 20% KOH on the infected hairs and crushing open the nodules to reveal the asca. It's epidemic to tropical areas such as Africa, Asia, and Latin America. Pedra horte, as far as colony morphology, it grows at room temperature. It produces a compact greenish-black heaped glabrous colony. Remember, glabrous is kind of a leathery, smooth colony. It produces no aerial mycelium, and it slowly forms. For microscopic, what you're going to see under the scope, you'll see dark, thick-walled hyphae with swellings. Asca with ascospores may be present also under the scope. Here's a couple of images of the black pedra caused by the Pedra horte fungus. This is an image of a scalp, and you can see the nodules on the hairs. In here, zoomed in, this is the hair shaft and the black nodule on the hair shaft. The next species in our superficial list is Trichosporum. The most important species in this genus is Trichosporum acei. Trichosporums can cause white pedra, which is or it occurs on the hair shaft and is characterized by soft white mycelium mats that occur or surround the hair of the scalp, face, and pubic regions. It forms light brown soft nodules that are less firmly attached than that of the black pedra. It's endemic in regions of South America, Africa, and parts of Asia. For colony morphology for Trichosporum, the color is straw to cream and yeast-like. The colonies are varied and can be smooth, wrinkled, dry, or moist. creamy or velvety in appearance. Growth usually happens within 5 days on the SAB heart infusion, and they can grow at room temperature. For microscopic appearance of trichosporin, you're going to see hyaline hyphae with blastoconidia and arthroconidia. Biochemical testing can be used for ID. This is an image of bipedra of the trichosporin species. Also in the superficial category is Hortia warneckii. It causes tinea nigra, which is brown to black, non-scaly patches on the palms of hands and the soles of the feet. There's no inflammatory or other tissue reactions to the infecting fungus. This fungus is easily confused with malignant melanoma, could lead to a misdiagnosis and unnecessary surgical procedures. It's endemic in tropical areas such as Central and South America, Africa, and Asia. For our diagnosis, we can use a direct exam method of skin scrapings placed in our 10 to 20% KOH solution. For our colony morphology for this species, we have slow-growing, shiny, moist, yeast-like colonies that start with brownish coloration and eventually turn to olive to greenish black in color. For a microscopic ID of what we're going to see under the microscope, you're going to see septate hyphal elements and budding yeast. In our younger cultures, mostly you're going to see budding blastoconidia, and older mycelial portions of the culture. It's going to show wide profusely septate hyphae with blastoconidia in clusters. Here's what Hortia warneckii looks like under the scope. Here's what it looks like in culture. This is at 16 days when it's been incubated at 30 degrees Celsius. So this is older culture when it's turned to that greenish black color. Here's another image under the scope. This is more of the yeast form. This is a picture of Hortia warneckii on the skin. This is why a lot of times it's misdiagnosed as malignant melanoma because of this black patch on the skin. This concludes part 1 of this lecture. I will see you over in part 2.